We now have Courtney Franklin, who is going to present online, but then take questions live. So we have a recording of Courtney's presentation on addressing inequalities in childhood febrile illness associated with paediatric emergency department attendants. And Courtney is another one of our ART PhD students working with one of our colleagues over at Alder Hey. So over to you, Courtney, virtually.
Hi, I'm Courtney, a final year PhD student at the University of Liverpool, and today I'd like to talk to you about part of my PhD, coming in hot, parental perceptions of reasons for attending the ED for fever. Fever can be a presenting problem for a wide range of illnesses, most of which are self-limiting or can be due to more serious bacterial infections such as meningitis. This poses a diagnostic challenge for doctors and is also a cause for high parental anxiety. It's one of the most common reasons for children attending the ED, and these rates are rising. There exists a social gradient where children living in disadvantaged conditions are more likely to both develop infections and to attend the ED. My PhD as a whole aims to address these health inequalities associated with paediatric fever and emergency department use, looking at areas such as differential healthcare access and outcomes. One of my studies in my PhD is a qualitative study designed to explore the perceptions of parents and doctors for the reasons children attend the ED for a fever. This involves Zoom interviews with doctors who have treated a febrile child in the ED and also with parents who have taken their febrile child to the ED. So I want you to stop for a minute and think as if you were a parent. You notice your child has a fever, so what next? How do you feel? Is this your first experience? How do you manage the fever? Are you confident in managing the fever? Do you get advice? Who do you get that advice from? Do you trust them? Are they even available? Importantly, is what you think you would do what you really would do? And if it isn't, what are the things that change that? Navigating the healthcare system can be really complex and difficult to understand. Despite majority of causes for paediatric fever due to self-limiting illnesses and not requiring emergency care, we're still seeing high levels of ED attendances and admissions. So how are children attending and why? Interviews showed a wide range of parental perceptions and attitudes towards primary healthcare services. Parents also spoke about the barriers they may face when seeking care for their child, from the Rottweilers at the GP reception desk to the 111 call handlers who parents felt couldn't navigate that grey zone. Some of these barriers fed into reasons why they attended hospital, as well as other factors such as their child's additional symptoms, the height of the fever, and not being able to safely manage the fever at home. These doodles are some of the initial work that I did when analysing parent transcripts and show how many factors parents might have to consider when seeking medical help for their child, not only for a fever but other self-limiting conditions. As part of my work, I used thematic analysis on the parent interviews, and this showed that there are many factors that could facilitate or hinder unscheduled care. Some of these major themes were previous parental experiences, social networks and their access to services, fever phobia, uncertainty and anxiety, and seeking reassurance. How we behave can be influenced by our emotions. Navigating the healthcare system can be a cause for anxiety, especially if you're seeking care for your sick child. Experiences that have an emotional impact, whether positive or negative, can not only influence our decision making at that time, but also influence decisions we make in the future. Fever is a major cause for concern for parents. Familiarisation with parent interviews uncovered a range of factors that influence parental anxiety during their child's care pathway for fever. The child's age, uncertainty, being a new parent, additional symptoms are some of the examples that had a part to play. Journey mapping is a method that's used widely in the commercial industry where businesses explore consumers' journeys. But why not can we use this in the healthcare research? So to unpack the emotional component of these journeys further, not only did I use thematic analysis on the interview transcripts, but I co-created emotional journey maps with parent participants at the end of their interview. Parents selected touch points that were important to them, from the onset of their child's fever all the way through to leaving hospital. They then used a scale from happy and no anxiety to extreme anxiety or concern and spoke about how they felt at each point. This was of course subjective to how each participant perceived their emotions during their experience, but it helped to unpick how emotions influence their journeys. So after these interviews finished, I further analysed the maps created, including the verbal data from the transcripts, to create a much fuller, holistic reflection of each parent's pathway. The example shown is broken down in 4 parts as the parent travels through their pathway. First, the chronological outline of what happened. Second, the emotional scale parents described in levels of anxiety at each touch point. Third, the verbal data informed parents' experiences at each point, explaining why did the parents feel the way they did. And finally, and arguably the most importantly, I highlight the possible problems that arise at each point. For example, barriers parents face accessing appropriate care, which may have resulted in avoidable emergency hospital use, the provision of fever thresholds that may have been inconsistent between the GP and the hospital, which then led to confusion in parental understanding of fever, and further distrust in health service advice. Overall, these maps highlighted that a parent's emotional scale and their child's treatment may not be a linear relationship. A child with a self-limiting illness and a parent with relative confidence in management of fever may have still had touch points that influence anxiety and therefore led to the final decision of ED attendance. This study could better inform several things, not just for fever, but for other non-urgent conditions as well. From the provision of unified medical advice, the benefits of better support in the community, the perceived access to health services from parents and how parents use them, the triggers for parental anxiety, and how this impacts their decision making. So at the start, I asked you to think as if you're a parent. I now ask you to think as if you're a healthcare professional. You should have received a handout with an example of this pathway, and you'll see that at the bottom, the problem section is left clear, because I now ask you to consider the following. Has emotion had an impact on the parent's journey, and how? What barriers has the parent faced when accessing care for their child? Could these barriers have been avoided, and if so, how? And what policy changes could have a beneficial impact on this? I'd like to thank the participants that involved in this study, my study team, including Paul Moran, our public advisor, who helped the design and analysis of this work, and to all of you for listening. Hopefully it's shed some light into consideration into the pathways across the whole healthcare journey. And I'd like to now pose the question to you if you have any questions for me.
So thank you very much. You'll see that there are charts on the table, but before we do those, any quick questions for Courtney? While you're thinking, this is a big problem for primary care as well, and it's always sad to hear when people feel they have negative experiences with general practice, but it's not straightforward. I've done home visits when I've seen 3 or 4 generations of women in the same house, and when the great grandma says, well, if a child has any sort of fever, you need to call the doctor out, that you know that home education is probably not going to be very helpful. So it's quite challenging in all areas of care, but apparently Thursdays Alder Hey used to be fun when one of the local GPs was the admitting physician who would see a lot of the children who came in with fevers, and sometimes was able to say, now, what did I tell you yesterday afternoon when you brought Johnny in? Have you done it? Because there is that sort of seeking of reassurance. We did do an ARC study, or a Clark study, in fact, that household survey. The only significant factor for A&E attendance from all the different things we looked at was how close people are to their local A&E department. So these are very difficult problems to manage. Hopefully that's given you time to think of a question or two for Courtney while she's here and eager. Yes. Anyone else while we're thinking where mics are going next? We've just got one question, then we're going to do the table work then, Courtney.
Hi, Courtney. Obviously, there's quite a lot of effects. I don't know whether you've looked at it, of social media stories about parents who've been turned away several times from professionals and whose child has maybe become very ill or died, and when it's not been correctly, looked at. So I think that does trigger parental anxiety as well. So have you looked at in what situations children are coming to A&E with a fever when it does need to be looked at, and could that be communicated better to parents so that they're not bringing children that don't need to be seen as often, if that makes sense?
Yeah, definitely makes sense. This was a relatively study, but even within that small sample, there were some that had febrile seizures and things that were definitely required emergency care, as well as those that were also self-limiting factors. I can't remember if I'd mentioned this as well, that within these interviews, we also did speak to ED doctors. And that is something that definitely came up in these sort of public health campaigns, things like the sepsis campaigns, which are right and need to be done. And people definitely need to understand the difference between being able to identify those that are self-limiting and that are serious, but also maybe that there needs to be more careful consideration in that balance of making sure that parents are well educated and know what to do, but also not scaremongering them in some way and worrying them and adding to that fever phobia as well. I think coming out of the pandemic as well, that's probably exacerbated that a bit, because they didn't have that community support, especially for young mums or first-time mums. That definitely did come up. I think a larger study that would look into that would be better, because there's only so many inferences I could probably give there. But that's in such a small study, that was already quite a big problem, not just for the parents that came out of that, but also the ED doctors saying that as well.
Thank you. It's not unusual, I think, for people to attend, if they have a major children's hospital, for a second opinion as well, even within 24 hours, because they don't trust what they've been told. There's a lot of parental anxiety, understandably, and it's how that's managed. Courtney, could you explain to us what you want us to do with these charts, please?
Yes, it was really more for just your consideration. The idea of this study is the method is really new, and largely probably has quite a lot of weaknesses. So in terms of the method, I just wanted to be able to feel the best way I could engage with you today is just to be able to have that sort of thought process, I guess, of the whole holistic journey. I was thinking of in terms of the doctor interviews that I had, and there was a lot of cases where they would say, you know, this child has arrived and they're well, and why have they ended up here? And it was so important for me to make people realize that it's not just at the start of their journey, it's not at attendance to A&E, that there's a whole load of other things that have gone on there that the parents have had to experience. So I'm not giving you any homework. My only homework.
Well, I am. I'm going to give people a bit of homework, actually, Courtney. So I'm going to say,
if you want the homework, I am going to give them
a bit of homework. Can I suggest that what people do is that they put on the top of the sheet, because you're asking a question, what could make a difference? And what we can do is give you nearly 50 different perspectives from different types of people here, what their perspective would be on what might make a difference. I don't have to fill all the boxes, but to put something in some of those boxes would, I guess, be quite useful feedback for you on your findings from a diverse audience of health professionals and public. So can I suggest that people title this with whether they're a healthcare professional and what type, sort of specialist or primary care or whatever, and what profession, or if they're not, and whether they're a parent or a grandparent, or both. Presumably you'd be both if you were a grandparent. And then that might be useful for you. And then we can, if I can ask you to then put it on the person-centred complex care table, which is over there, before you go, then Pete can collect them up and then hand them on to you next time you're in. And then you'll have some new data. Would that be helpful?
That would be really brilliant. Thank you so much.
Would be helpful. So please do that. It won't take you more than a couple of minutes over the coffee break.